Public Health PIO Janela Carrera is standing by with Environmental Health Division Head Malus Groggs. Good morning, ladies.
Hi, good morning, Chris. Good morning, Bree. Good morning, Jason.
Good morning. Good morning, Malu.
Good morning, Chris. Good morning, Sabrina.
Good. Sabrina's off island for a couple weeks, taking care of family stuff.
Oh,
Right? Yeah. So you got me. Hope that's good enough. But I guess we'll just start. I guess we'll start with you, Malu. Maybe like a status update on inspections that you guys have been doing this week, last week, or since the last time we talked to you.
Okay, it's there's not much changes from the last time that we spoke, Chris. As to the citation, it remains the same. 14 citations that were issued by our division or our department, and out of the 14, already 2 paid the fee, and there's 4 that contested, and their hearing is scheduled next month. As to the others, we haven't heard what is the status, if they already paid the penalty fee or not. We're still following up on that. As to complaints, we haven't received much. We're not receiving much complaint as for the past week. Maybe because more restrictions were lifted, and the opening of non-contact sports are already allowed. Games and competitions are already allowed. So we haven't received much complaint as of last week and this week.
I don't know if that would be you or maybe even Janela, but what can you tell us about this Subaki Tower?
yeah. So, other than what was already stated in the media, we don't really have much details. What we can say is that, of course, on public health side, there is a contact tracing that's been initiated, and we're very confident in our surveillance branch to conduct our MedOps branch to conduct the efficient contact tracing. Starting with, of course, the index case. It's still under investigation, so we're working very closely with the hotel management. We're very glad that Subaki Tower has made that decision to go ahead and close down the restaurant side so that they can clean and disinfect the area. But other than that, there's really not much to say other than that what has already been stated in the media. But I think this really goes to show, and it's very important to emphasize, the need to continue with following the guidance and the memo, the guidance memo, in terms of wearing your mask when you're out eating and dining, when you're not actively eating, and for employees to adhere to the protocol of continuing to wear your face mask. And also the sign-in sheet. And so that's why we have these policies and procedures in place, because even when cases seem low, we seem to be in the right place, something like this can happen. So, just wanted to point that out.
Are you able to say how many cases so far? Because there was the one, right? But how many additional positives were there in that kind of Subaki? I don't want to say cluster, Subaki case.
We're actually, I'm actually not sure and not too familiar in terms of what the investigation, what the details are of the investigation in terms of how many positive cases there are. And that's part of what the investigation is trying to, or what the investigation is doing, is to determine how many more positive cases there may be following the index case. what I can say is this is not defined as an outbreak. So, in terms of employees and any potential customers that may have come into contact with the index case, that's still part of the investigation. I do want to point out that, or I do want to share that I did get a phone call from an individual who was at the Tsubaki Tower or hotel this past weekend, and they contacted me, and of course they were concerned and said, I was there this past weekend, I ate at one of the restaurants, what do I need to do? And so what I told them was, if you are a close contact, and if you did the proper procedures, you signed in, I wouldn't be too concerned. You will be contacted if you are deemed a close contact. And typically that's, 15 minutes of exposure to a known positive case. But the bottom line is, if the positive case was wearing their mask, even if you took off yours so that you can eat and drink, and I asked them, do you know if you were ever near a server or around a server for more than 15 minutes? Those are some of the questions that you should ask yourself. So, these are the types of concerns I understand some people may be having if they were at Tsubaki Tower over the weekend.
Yeah. And we went through this again. This was pretty commonplace back during the surges, where you'd have a positive at a place and they'd have to, cause. So we did get a couple comments here, and you did address it, but I just want to read them out. Is there contact tracing for guests that frequent the restaurant over the weekend? James Ken Ariola says, how about patrons and staying guests who were there? And I mean, I'm sure you can appreciate that you only contact people who had the close contact, which according to the CDC is defined as 15 minutes within 6 feet without the mask, correct?
Right, without the mask.
Right.
Or even if there was a mask, but if you are over 15 minutes of exposure within 6 feet, then you will probably be deemed as a close contact. And that's what our contact tracing team does is, they interview those positive cases to determine who their close contacts are. And that's why that sign-in sheet also is very important, because if they were near a customer for that length of time, then they can contact that client or that customer.
Right. And so I guess, guys, if you don't get a call, I mean, it's kind of weird, because I think any call, even if you weren't, I mean, if you were cleared, right? I mean, so with the contact tracing, when they get the list, they go down the line for these 2 restaurants. Is it part of the contact tracing investigation to just call everybody and say, hey, were you within 6 feet? Is that what's going to happen?
I probably asked Malu to.
Malu.
I'm not really familiar also what is the of the contact process, but what I know is they will interview the person that tested positive.
Right.
And who are those, who are her or his contact, close contacts. Then they will go from there. I think that's all I can share. I'm not involved in that.
Yeah.
We are all, our division is only informed when we need to conduct an inspection because of a cluster. But I don't know if you call this, they consider this as a cluster, because my office, our division wasn't asked yet to join an inspection with the medical ops.
But Malu, your division is responsible for inspecting these establishments to make sure they have things like the sign-in sheet.
Yes, and we did inspection of Tsubaki twice.
And obviously they had the sign-in sheet. So you guys, if you go into a business, if you're one of these people who complain about having to sign in, this is why you have to sign in. So in case something like this happens, they know who was there, what to do, who to call, and all that.
Yes. Very important. It's very important too. I just want to emphasize that you put the correct information, the correct name, correct phone number, or email address.
Are you guys finding that people don't do that?
And I'm not saying that people don't, but I just want to point out that it's probably a great idea that you do.
Right. Yeah. Malou, so let's just double back here with the sign-in sheets. When you inspect the places, are you finding that most of them are in compliance with having the sign-in sheet in place? She looks frozen. Usually this works. I don't know how it usually works though.
I know sometimes the internet connection there will just drop off for like a split second.
Right. Are you guys getting any funds for that? Is it getting a grant for the internet? Malou, did you hear me? Are you there? Did you thaw?
Yes, I'm here.
Okay.
I'm sorry.
No problem.
I think it's on my end.
Yeah.
Or
I know it's cold in there in your office. That's why you're freezing up. But again, Malou, just to ask, when you go out and do the inspections, are most of the businesses complying with having the sign-in sheet and all the other different protocols?
yes. So far, the previous weeks, we haven't observed businesses that are not complying.
Are we pretty much, I mean, so other than the first round of inspections where you went to a couple bars and the people weren't wearing the mask and there were some issues and people got cited, that being said, are you finding now when you guys go out that everyone kind of gets it? What they have to do?
I think because we're actively going out, even there's no complaint, especially on the weekend, because that is the busiest days and nights of this eating and drinking establishment, especially bars. So they're aware already of the requirements, because there's even a staff that assigned to enforce their policy or their COVID mitigation plan. Especially those establishments that we cited. It's not because we cited them that we forgot about them already. We do a follow-up inspection. We do on-spot inspection just to check if they're really complying.
I wanted to ask, because we had Senator Moylan on, and I believe he wrote a letter to the director about the ballrooms. So what's the protocol right now for the ballrooms? And do you believe that it can be changed to allow them to have, I guess, like kind of the regular functions that they normally have?
There's no change yet as to the ballrooms, because the limit for congregation is still 50. So any function or any special event held in ballrooms, hotel ballrooms, or any eating and drinking establishment, they're still limited to 50 individuals or 50 persons per party.
So can't have more than 50 people, no matter what, in a ballroom.
Yeah.
Right.
No more than 50 guests.
But if they were to get creative, like they could do 50 and then bring another 50 in, right?
Okay, maybe if they do 50 in an hour, as long as those 50 people leave, then another 50 we might consider.
Yeah. It's just interesting because I don't, like, with the 75% capacity and the social distancing, are these places, and I don't know, so I'm not trying to be, are they able to get up to 75% capacity with having to put people 6 feet apart?
No, Chris, I don't believe that they can reach the 75% occupancy rate if the 6 feet social distancing is maintained. Because sometimes this is how they derive the occupancy occupancy load or maximum occupancy load. It depends on the type of operation.
Mm.
Just like for gymnasium, it's 7 square feet per person. And if you look at that 7 square feet, it's very small. It's just like 2.6 by 2.6. So if you maintain the 6 feet social distancing, you need 36 square feet per individual. So if you multiply that with the 75%, there's no way. It's the total square footage that you need to reach the 75% and maintain the 6 feet social distancing is way over the available space.
Right.
So I don't believe that businesses that allowed to have that 75% occupancy rate, that they will maintain the 75 the social fit, the 6 feet social distancing.
Malu, let me ask. So when we, if everything goes according to plan, pat the half, we smash it. May 1st, we reopen the island. What is that going to mean for capacity limits and social distancing? Like, are we still going to have to be social distancing 6 feet apart in, let's say, if everything goes good in like July or, you know, down the road? Is that just always going to be part of the equation?
I cannot comment on that, Chris. If we're still gonna allow that, depending on CDC recommendation, because we follow CDC recommendation or guidelines.
Right. Okay. Anything else, Malu, you want to add here? You got anything? You got
No.
anything juicy, girl? You got anything? Where's the real stuff? Just between us. You're good. Okay. Hey, American Bakery, they're back up and running, right? It's all good.
Yeah, they're good.
Okay.
I was just there the other day.
Right on. Okay. Janella, how about you guys? Oh, we had a question about testing. Someone was asking when the next testing is. Do you know?
So we as you know, we just had one yesterday, but I don't believe we have any for the rest of the week. We may try to plan one for next week. But if anybody is in need of testing, they may be feeling symptoms or they need something for travel, they can always contact our Northern Public Health location at 635-7525 or 7526 to schedule an appointment. And then of course there's available testing at our private clinics, and they can contact those clinics that may have testing available.
Well, thank you, Janella. Thank you, Malu. Appreciate it.
All right. Anytime. Thanks, Chris.
I'll see you. Oh,
Thank you, Chris.
can you send me the inspection reports when you get a chance?
Okay, yes.
Okay,
I'll send them to you.
Thank you. Right on, ladies. There you go. Public health. We're gonna take a quick.
Hey, so
Oh, yes, Jay.
American Bakery's back up.
Yeah, they are.
Dude, let's go get some Shupao, man.
Go get it, man.
Yeah.
You first.
Hey, you buy, I fly.
You be the Shupao guinea pig.
Yeah.
9:43. Cover Me, which is proudly brought to you by Burger King on this Whopper Wednesday. Remember, Whopper Wednesday. You can go